10 common signs of appendicitis. Appendicitis is inflammation of the appendix, a blind-ended tube connected to the caecum. The caecum is a pouch-like structure of the colon that is considered to be the beginning of the large intestine. The appendix is located at the lower right side of the abdomen and doesn't seem to have a specific purpose. Appendicitis occurs when the appendix becomes blocked by a calcified stone made of feces. If left untreated, an inflamed appendix will eventually burst, releasing bacteria into the abdominal cavity. This can lead to a serious inflammation of the abdominal cavity's lining that can be fatal. Here are 10 common signs of appendicitis. 1. Pain around the belly button. In most people, the appendicitis pain begins around the belly button and then moves to the lower right side of the abdomen. It will then intensify quickly within a few hours and requires immediate medical attention. 2. Painful coughing. As time progresses, the pain will get worse when you cough or sneeze. People often compare this pain to the kind they experience at the time of a rib injury. 3. Abdominal swelling. You might experience some swelling in the infected and surrounding areas due to the appendix becomes inflamed. It could be extremely sensitive to the touch and causes pain across the entire abdomen. 4. Nausea and vomiting. Inflammation of the appendix can impact the gastrointestinal tract and the nervous system that can lead to nausea and vomiting. You may experience nausea and vomiting soon after you start to experience abdominal pain. 5. Fever. You may get a fever with appendicitis. Appendicitis usually causes a fever between 99 degrees Fahrenheit and 100.5 degrees Fahrenheit. If your fever is worsening and you also have stomach pain, then it is time to visit a doctor. 6. Loss of appetite. One frequent symptom of appendicitis is loss of appetite because appendicitis can also obstruct the gastrointestinal tract. 7. Constipation or diarrhea. Constipation or diarrhea may also occur, and if either of these symptoms is present with other symptoms, then it is time to visit a doctor as soon as possible. 8. Rebound tenderness. Along with abdominal pain, most people with appendicitis often experience a symptom known as rebound tenderness, a sharp pain that occurs after you push on the lower right part of your abdomen and quickly released. 9. Pain when moving. The pain could become very severe, and it may hinder your ability to move. You may notice a sharp pain when you walk. This pain is usually around the lower right of the abdomen, and it could spread down to your legs. 10. Inability to pass gas. Many people experiencing appendicitis will be unable to pass gas because appendicitis usually comes from an intestinal blockage. A complete intestinal blockage can result in an inability to pass gas or stool. Final thoughts. Appendicitis is a common condition that leads to surgery. Around 1 in every 12 people develop appendicitis at some point in their life, and it most often occurs between the ages of 10 and 30. Even though you can't prevent appendicitis, you can reduce your risk of appendicitis by having a diet that is rich in fiber. Increasing fiber intake in your diet can prevent constipation and subsequent stool buildup. Stool buildup is the most common cause of appendicitis. If you liked the video, give it a thumbs up and subscribe to the channel.